use a cup, whether it's glass or plastic. And some of the practitioner, the old school practitioner, like to use a bamboo, like a section of a bamboo, and then use a heat or use a hand pump to create the suction. Cupping itself, I use, of course, every practitioner use it differently. I do like to use it for a lot of soft tissue, scar tissue, pain, and also muscle fatigue as well. So how it works is that we use a cup, whether it's glass or plastic, and some of the practitioner, the old school practitioner, like to use a bamboo, like a section of a bamboo, and then use a heat or use a hand pump to create the suction. So this way it brings out what we call stagnation in the meridian, because the meridian runs everywhere in our body. So from the front of the body to the back of the body, or on the trunk, on the extremity, everywhere of our body has meridian passing by. So it's pretty safe to use cupping to treat, like that says blood stasis and chi stagnation that shows as pain, as weakness of the muscle. So when we use the fire or hand pump to create suction from the cup, it draws blood to the surface. And a lot of times, because when the blood flows to the surface, a lot of them, it can also help with detoxification, detoxing it, because blood stasis, chi stagnation, they are considered a toxin. So by bringing that blood into the surface, they are also helping the blood flow as well, and that can help with the detoxification. Well, acupuncture definitely can help with either acute or a chronic issue. The application of acupuncture is so wide. You can use acupuncture for infertility, you can use acupuncture for pain, migraine, long COVID, or cough. There are a lot of things that acupuncture can apply to. Cupping, however, from my own experience, is that I use it more for pain, especially acute pain, and scar tissue as well. So if there's a patient that come in, and I do find that there's a lot of scar tissue, I will use cupping complement to acupuncture. If the patient has pain, whether it's acute or chronic, and I'll probably still use cupping complement to acupuncture. And acupuncture is something I do find that it's more applicable to a lot of health issue. But I think, having cupping complement to the acupuncture, I think it's just as beneficial as well. So because remember that it creates a suction, so it does bring the blood flow into the surface. So if you have a bleeding issue, or you are on, let's say, anticoagulant or blood thinning agent, then I would say you need to be careful about that. Not to say that you shouldn't, but it should be evaluated by your practitioner. If you like this video, please subscribe and follow me, and I'll see you soon.